Good afternoon, everyone. This is Dan Dunlop with Jennings. We're a healthcare marketing firm based in Chapel Hill, North Carolina. I want to thank all of you for being here today for our webinar with Dan Hinman. It promises to be extremely interesting and educational. The title of the webinar is People-to-People Healthcare, Improving Health, Building Loyalty, and Personalize Your Marketing with Online Patient Communities. I am coming to you live today from the Park Plaza Hotel in Boston, which tends to be the most affordable hotel I can find in downtown Boston. And it is under major renovation. So if you hear jackhammers in the background, truly they are jackhammering just outside my door. So thanks for bearing with any of that noise you might hear. Let me tell you a little bit about our presenter, Dan Hinman. Dan has been providing advertising, marketing, and public relations solutions for clients for more than 3 decades. In 2010, he founded Hive Strategies to help health systems create HIPAA-compliant online communities for better health, lower cost, and greater patient engagement. In this work, Dan partners with Jennings and Care Hubs to provide a turnkey online community solution. Care Hubs community software clients include Mayo Clinic, some pretty big names you'll recognize, Memorial Sloan Kettering, Seattle Children's Hospital, Arnold Palmer's Hospital for Children, and so on. Dan's a popular speaker at healthcare conferences. He's a member of the Social Media Health Network, a member of the External Advisory Board of the Mayo Clinic Center for Social Media, and a contributor to Reagan's healthcare news feed. Dan's been a friend of mine for several years, and I respect and admire him and appreciate his vision for where he sees healthcare marketing going. And I look forward to hearing his presentation today. A few ground rules for today. You are all muted. Please, if you have questions, and I hope you do have questions throughout the presentation, enter them through the chat mode on your control panel. So go to chat, type in the questions within chat. I'll be monitoring that, and then hopefully at the end we'll have plenty of time for Dan to answer those questions, and I'll read them back to him. So again, if you have questions, enter them through the chat mode. You're muted just because people put us on hold and we get all this background noise and so on. The other thing I will tell you is this is part of a series of webinars. I think this might be the 3rd or 4th that Dan and I have done in this series. We're doing them about every month and a half or every 2 months on this whole notion of online communities and the importance of online communities in healthcare marketing. So keep an eye out for future sessions that we'll be doing. I'll be hosting the next one in the series. So with that, I'm going to turn it over to our speaker, Dan Hinman. And Dan, take it away.
Hey, thank you so much for the introduction, Dan. Dan said he's coming to you live from Boston. I'm coming to you live from McMinnville, Oregon, where we don't have 5 feet of snow. We have beautiful weather in the Northwest, and I don't have any jackhammers outside my window, but occasionally there is a groundskeeper who comes by and makes some noise. So I hope we don't get that interference today either. I'm really grateful to have a chance today to share with you some of these ideas about people-to-people healthcare. Thank you for joining us in the webinar today. We start with this great quote by Susanna Fox: "The most exciting innovation in healthcare today is people talking to one another." And some of you are saying, well, who is Susanna Fox, and why does it even matter what Susanna Fox thinks? So just a little background with her. She was previously with the Pew Research Center's Internet Life Project, and now she's an entrepreneur in residence at the Robert Wood Johnson Foundation. But her real expertise, Susanna's real expertise, is helping people navigate health and technology. So she is a forward-thinking visionary in the field of healthcare and digital, and that's why her thoughts here are so important. What Susanna is really referring to here is the innovation that's taking place in online patient communities. So when people are facing health challenges, struggling with the unpredictability of a new baby, or burdened by the role as caregivers, the demanding responsibilities that come with that, when they begin to connect with one another, when they share experiences, when they help problem solve, when they build a sense of community with each other, then really remarkable things start to happen. They provide this support, they share ideas, they solve problems for one another. They begin to bond as a community, and they also bond with the organization that brings them together, and that's your hospital. Your hospital has the opportunity to create that environment where people can come together, bond with each other, and bond with your health system. And as they do that, then why are these communities so important? Because they're key to patient engagement and empowerment. So let's talk some about that. People with the ability to connect to each other through their computers, their tablets, their smartphones, wherever they are, and it makes a big difference. Whether they're caregivers, bariatric surgery patients, patients with cancer, rare diseases, diabetes, traumatic brain injury, all of these are potential online communities. So let's share some examples of communities. And Dan mentioned that in our partnership, there's Dan, there's me, there's also Care Hubs, who provide our HIPAA-compliant online community platform. And so one of the examples we're going to look at quickly here is the Dana-Farber Cancer Institute program for young adults. So Dana-Farber has done a really smart thing. They could be a cancer hospital, which they are, but they can also develop a stronger and narrower niche by deciding that they're a cancer hospital for young adults. Young adults have very different needs from people who are diagnosed as infants or diagnosed later in years. And so they said, let's identify this community of young adult cancer patients and let's create an online community for them to come together to talk about lifestyle, work, school, family life, emotional development, all the things that young adults are thinking about and struggle with in unusual ways when they're diagnosed with cancer. Another example of an online community is Infertility Community. This one actually is sponsored by Inspire. But what you see on the screen right now is part of a daily digest that's mailed to members of that community every day, showing them new conversations or replies that have happened in the last 24 hours. So this daily digest typically has somewhere between 20 and 40 conversations that are ongoing. And as you look at the topics from these conversations, you see how very specific these conversations can be with people. My most interesting one is the third one down, where Piano Girl says, "My IF story," and then uses these abbreviations to describe what she's going through that are very familiar with people that are going through infertility treatments. Just an indication of the level of communication and sharing that goes on within this community, a very specific niche, patients with infertility. Vanderbilt Health has a different kind of a community for their bariatric weight loss patients. They decided they would establish a private Facebook page. This screenshot that I'm showing you right now is just of their general Facebook page. We can't access the bariatric community because it's private. But I had a chance last fall when I attended the Mayo Clinic Social Media Summit, and my good friend Cynthia Floyd Manley was there. She gave me a peek into this community, this very vibrant community that's happening on Facebook for their bariatric patients, where about 400 different patients are engaged in that community. Every day, somewhere between 15 and 20 different conversations take place between those patients. If you can imagine the journey that a bariatric patient goes through from when they first want to receive the surgery, going through the waiting period, the qualification, the losing weight, stopping smoking, whatever they need to do to qualify, having the surgery, the dramatic lifestyle changes that follow. This is a path that is about a 2-year path for bariatric patients, and this opportunity to connect with others going through the same situation and circumstances is a powerful one. we don't recommend Facebook communities because there are some other issues with it. Facebook can change the rules at any time. It isn't necessarily HIPAA compliant in terms of the information that you share, and for a host of other reasons. But sometimes it's a good way to start a community. You migrate it from a Facebook community into these stronger HIPAA compliant communities that have many more features and opportunities for management is actually a really strong possibility. But I wanted to share this as an example of a community that's very vibrant and doing well, with really a smaller number of patients who are just really strongly engaged with each other. Mayo Clinic has a worldwide audience, of course, patients from all over the world, a global impact. And so they said, let's set up a community to allow our patients, wherever they are, to interact with each other, to share stories, to get more information about illnesses, disease, to ask experts for ideas and suggestions. And so they created Mayo Clinic Connect. They have about 30,000 patients who have signed on to this community. So it's much larger than the bariatric community, and it's a broader community. Patients of any kind of illness or condition can come to the community, and even non-patients. If you had a question or were interested and you weren't a Mayo patient, you can come to this site, you can ask questions, you can look for information. And so it's part of their broader outreach to a global community. The next example that I have here is KinTalk. And the Mayo community is an example of a CareHub's platform, so is KinTalk. So this is a whole different, again, how fascinating the many different kinds of online communities there are to help patients. But UC San Francisco said, we have an expertise in hereditary cancer, specifically Lynch syndrome and the BRCA1 and 2 genes. And when we diagnose this with patients, one of the first things they ask is, wow, how is this going to impact my relatives? I have a hereditary cancer. What does this mean about my sons and daughters, my brothers and sisters, my cousins? How will this affect them? And so they established this community called KinTalk that is this amazing way of families going in to get information and to share their health history with select members of their relatives so they can come into the conversations, find out the risks, the circumstances, what they might be going through if they were to contract the cancer and really affect their lives. Now, you'll notice the branding on this page. Nowhere on this page does it say UC San Francisco. If you could see the whole home page, and you can access this by Googling KinTalk and getting to the site. But if you looked at the whole page, you don't see any branding for UC San Francisco. So part of their strategy is to outreach to anybody anywhere who is dealing with these hereditary illnesses, to invite them to learn about it in the community. And imagine that if I found this as a remarkable resource, how much more interested I might be in going there for my care. And so that's a really powerful strategy that KinTalk is implementing. And this, again, is an example of a community that CareHubs has established. Let's see. Somehow I've lost my connection. One second. Let me fix this. No, that's not what I want to do. Okay, Dan, are you still there?
I am.
What do you see on my window right now? Because things are popping up.
I see a slide that says how virtual Handshake works.
All right, nothing else then, huh?
Nope.
Okay, let me keep going then. So, a virtual Handshake is a product created, again, by CareHubs with the Seattle Children's Hospital. And so Wendy Sue Swanson, who's a leader in social media and healthcare, really dynamic pediatrician who's always looking for better and stronger ways to communicate with patients, came to us and CareHubs and said, we want to have stronger ways, better ways to deliver valuable information to our patients before and after we meet with them in a care setting. We find that a lot of our pediatric patients have similar diseases or illnesses, and if we can give them valuable information, educate them before and after their visit, we can make that visit way more effective and powerful for them. And so this is a program that's set up where when a family or patient schedules an appointment, they receive an invitation through this virtual handshake. They log on to the online community. There they're greeted with a video by their provider, and also with educational materials about their child's visit. This includes PDFs and maps to the site and other things that come to them as they log on to this online community. They can also invite other family members to be part of this information sharing. So they can invite them into the community if they choose to. And then after the visit, the care team posts additional information that they may need to be able to, before they come to a next appointment or follow-up. It's a powerful way to develop video content and deliver it to patients as they need it. Now, one of the things they found that is most interesting about this is that they're able to treat patients farther from Seattle than they have before because of this online connection or interaction. Patients in Alaska and areas that normally might be reluctant to travel regularly to Seattle for care are able to get a lot of the great care and information through the online community. That's made a big difference for them. Here's another example of the Arnold Palmer Hospital for Children. This is a community where families can share their concerns about their children with each other and give support as kids go through some really tough times with their care. One of the big advantages then of these communities is the emotional support that it provides for patients. So here's a great comment from an online community member. I do not have any family support, physical or emotional. Times the isolation and the depression are too much to bear alone, and that's when I cry a few tears. It is receiving support from this group that is my lifeline. So in addition to this peer-to-peer support, we've shown examples already that these communities also provide some really essential other things for patient engagement, and that is accurate information. There is so much misinformation online today that when you're able to point your patients to a resource where you know the information they're getting is accurate, it's incredibly valuable. Beyond the accurate information, there's current news, there's education, and then there are also the opportunities to link to expert opinions. So those are people within your organization who agree to be part of this community to provide expert advice when appropriate through the online community. Of course, they're not diagnosing and treating through the community, but they can give great advice on a whole range of expertise that helps patients get the information they need to take the next step. And all of this is available, of course, 24/7 because it's online. Not that your experts have to be available 24/7, but the community is there to offer support 24/7 for these folks. So let's talk about what the research is showing about the benefits of having engaged patients. And in the last few weeks here, there have been some really interesting news items that have come across, and the research is showing that engaged patients have better health at lower costs. And so here are some examples. I'm having a little trouble with my screen. For 1 second, I've got to change something here. Okay, it's blocking the slides when I view them. But now I am back to normal. Okay, thank you for that patience. Okay, so researchers found that patients who were more knowledgeable, skilled, and confident about managing their day-to-day health had healthcare costs that were 8% lower in the base year and 21% lower in the next year compared with those who lack this type of confidence. I'm sorry, one more time. I've got things popping up on my screen that I'm trying to close. Maybe that will do it now. And they're interfering with my view. So again, I apologize for that. Okay. Uh, so what they found in this same study is patients who do not take an active role in their health care cost an additional 8 to 21% more than patients with high activation levels. And those who are more engaged and involved in their care, they saw a 6% increase in their levels of medication adherence. They see a decrease in emergency and urgent care utilization and a slight decrease in lengths of stay. So another survey shows that digitally active chronic patients are more satisfied with their health, even if they're not healthier. This is really a fascinating thing. They compared those who were online, digitally engaged with their care, with people of the same healthcare conditions who were not digitally engaged, and they found that they're far more likely to be satisfied with their health situation than those who are not engaged. They also found that being digitally connected was not a problem, that 98% of all the people surveyed had access to the web through multiple devices. And so sometimes we get this comment that, wait, an online community is going to limit who can be involved. And of course it is in some cases, but for the most part today, people have access. Regardless of income levels, people up to age 70, 75, 80 have access to the internet and are interested in being engaged in online communities. Another really fascinating recent release is that children with autism spectrum disorder thrive in online cultures. So online communities, if you're thinking about how to use an online community in your health system, and you have a situation where you're working with parents or children with autism spectrum disorder, an online community that allows them to interact can really provide some amazing opportunities. So here's a quote, for example: although I've learned to talk to people face to face, it's still 10 times easier and more comfortable to talk online. Here's also a very interesting story about a group of lung cancer survivors who convinced the National Comprehensive Cancer Network to update their treatment recommendations. And the story here is that these lung cancer survivors were part of an online community. And as they talked among each other, they discovered that the care they'd received that saved their lives was not commonly understood or applied by most doctors, because the National Comprehensive Cancer Network didn't recommend or include those protocols in their guidelines. That's a source where lots of oncologists were going to know what treatment protocols they should introduce to patients. Their particular protocol that had been so successful wasn't there. And so they learned that there was an open period for suggestions, recommendations. They put together their patient recommendations, and as a result, the cancer guidelines that the Cancer Network recommends have been adjusted or revised to include this additional kind of treatment. And Chris Newman, who you see pictured here on the slide, is one of the people in that group who was instrumental. And she calls this group a small but very important victory for patients. There's some other studies that also are quite interesting that we'll look at here. This other one is a study through the Journal of the Royal Society that says online social network dieting site found that those with more social connections were more likely to lose weight over 6 months. So in this study, they said, okay, there are 3 things we're looking at. We're looking at BMI, we're looking at how frequently you weigh in, and we're looking at friendships that you create within the network. And they tracked these things over time, and they looked at what had the very strongest impact. They found that the most significant of those 3 things in weight loss was a number of friendships. Those people that had that had a great number of friendships, 10 or more within the community, versus those people who did not create any friendships in the community had twice the weight loss in the study based on their interaction with other people. And then this study I love too, that Twitter helps smokers kick the habit. This is a recent UC Irvine Stanford study that showed that when people in the study tweeted each other with reminders and support to stop smoking, that they had a great deal of success and been very successful. Now the point here isn't so much Twitter, but the point is peers reinforcing behavior. And so in online communities, it is possible to set up Twitter connections in online communities, also texting, also phoning, also emailing. There are all kinds of ways that people can support each other, but the regular support that comes from people in the community when you're making behavior changes can really be profound in the success of that. So as we think about where do online communities fit, we have these examples of how they boost engagement, how they also improve behavior modification in people, and those are both powerful ways to help our patients enjoy better health and also do it at lower costs, as these surveys have already shown. Alzheimer's disease will be an epidemic here in our lifetimes, and the people that are sometimes most affected are caregivers. Overall, beyond including Alzheimer's, 66 million family caregivers live in the United States. What an amazing benefit it would be to those folks to have an online community that could help them cope with those stresses that come, many in a sandwich generation, caring for parents and kids at the very same time. So now you're saying to me at this point probably, wait a minute, I'm a healthcare marketer and you're talking to me about reducing costs of care, about patient engagement. What in the heck does this have to do with me? And my answer to that is it has everything to do with you, because the future of healthcare marketing is community. The most valuable thing you can do as a healthcare marketer today to prepare for the future is to raise awareness and initiate efforts to create communities for your patients. And as you do that, you will begin to build a valuable asset for your health system, which is this community of engaged patients. And then you will have the power to market your most valuable services to that community. And as you think about it for just a minute as a marketer, what could be more incredible than to have a defined community where you know exactly who those people are, what their interests are, what their relationship is with your institution, and can deliver the most effective messages to them in the time when they most want them and need them for their own health and well-being. That's part of that is possible because of the remarkable power, analytics that are available in these online communities, where you can know everything you want to about their activity. How frequently do they visit? How often do they comment? How long do they stay on the site? What are their interactions like? What questions are they asking? And you can do this on a macro level and on a micro level. What videos have they watched? How long did they watch them? Did they watch them again? All of these analytics are available in an online patient community that's properly set up. And it's one of the reasons why I made the point earlier. Facebook, of course, doesn't involve this kind of opportunity to engage with patients based on analytics, but a well-developed online community platform can provide that for you. So Devin Gross and Greg Blue are principals at an organization called ME Solutions that helps healthcare institutions develop more empowering ways for individuals to interact with them. So they said this: widespread changes in the healthcare system will require organizations to build a relationship with patients. And the healthcare organizations that come out on top will be the ones who understand this. Technology will play a role, but keeping the conversations personalized is key. So here is what an online engagement system, patient engagement system, or community really looks like. You have the patients, of course, in the middle. You have the peer-to-peer support that they receive. You have accurate information that comes as a result of the information you're providing members of the community. They get expert advice from your experts. They get content to trigger behavior change. And then you have this amazing opportunity to get regular patient feedback. So when we get more into patient engagement, this two-way communication opportunity where you can engage with your patients to ask questions about what they need, how you can better provide it, and share benefits for your system are really remarkable. There are some hurdles in this effort, and it's important to know and understand those from the beginning. So one of the first questions we get, and recently I had a friend say this to me. He's a VP at a major health system. We approached him on this on online communities. His first question was, can you share data with Epic? Well, we would love to share data with Epic and receive data from Epic, but Epic makes it, frankly, quite difficult to do that. And so interoperability is this idea that data flows seamlessly between systems. It's what we all want, but we are not there yet as a healthcare community. And you know this probably by you may be in health systems where your EHR doesn't communicate with the portal that your physicians use or those referring to you, and so you have all this data that doesn't easily go back and forth. That time hopefully will come. There are a lot of efforts to push towards interoperability in healthcare data. We are not there yet. But my point to you is don't wait for that. If you wait for that, you are going to be down the road 4 or 5 years, probably, before we have a system in place where information can just flow easily back and forth. So the response to that is it's coming, but who knows when. Don't let that be a deterrent to begin developing these really effective online communities now. Alignment is another issue, and by alignment I mean how do we make sure that all the protocols and systems are in sync within the organization? I know that as a healthcare marketer, you can't just decide, oh, I'm going to start a bariatric surgery support community. You don't have the power to do that. You have to interact with the clinical folks to help that happen. And that raises all kinds of questions about, well, how does this work? Who answers it? What if the information's right? What if it's not right? What if they have crazy ideas? What do we do about this and that? So there's an alignment that really needs to take place between you and the clinical side, to make this happen. That is work. And that takes some education and additional information. But again, it's work that's worth it because of the payoff possibilities. And then the third concern that people always have is, well, what's the ROI? If I put 50,000 or 100,000 or whatever into this program over a year or 2 or 3, what am I going to get back in returns? They want us to be able to prove that that investment will be possible. Well, we've shared some data already that shows how studies that have been released just recently show that increased engagement, lower costs, and improved health. But that's as much as we have right now. We don't have an online community that proves that. They drove additional surgeries strictly based on the community that resulted in X dollars of profit to the system versus what we paid to set up the system. So there is a little bit of a leap of faith here. This is totally logical. If patients are more engaged, their health care is going to be better and it's going to cost us less. But the dollars and cents that a CFO may be looking for, we don't have that yet, and it's not out there yet. But it will come as we continue to develop these. Don't let that be a reason to hold off on your experience with this. So what should you be doing? I love this concept. Think revolutionary. Think the concepts of your entire health system having these remarkable online patient communities that can benefit people and the system in so many ways. But act evolutionary, meaning take this a step at a time. And so some of the steps that we want to talk about you accomplishing would be, first of all, start with a very simple idea. Okay? Begin by saying, what is a marketing objective we have that an online community could help solve? So let's imagine you want to increase your bariatric surgery. That's pretty much a slam dunk. Let's imagine you want to increase the number of deliveries in your birthing center. There again, a new moms group is perfect for that. Let's imagine that you have as a mission to reduce the number of to reduce the seriousness of patients with diabetes in your organization, to keep that from moving forward. Somewhere where you have a marketing objective, ask yourself, what community could help me help solve that objective? Start with that thinking. And then you want to think small, because you want to test and refine and pivot with your online community. So you might say, okay, we've got an employed group of physicians who want to better manage their diabetic patients. And so how about if we work with them? Maybe it's 5 doctors, maybe it's 10, maybe it's 15. How about if we work with that group and create a community where their diabetic patients can be checking in on a regular basis? We can ask them to weigh themselves every day, test their glucose levels, and get a little exercise and plug that in to some data in the online patient community, and then share that information in a really simple way with the medical practitioners, with the providers. Maybe that's where we start, with one practice, and make this thing work, and then go from there. Maybe it's a single service line like your bariatric surgery. Maybe you do have a desire to help children who are on the autistic spectrum disorder. Maybe it's new moms, so you want to have growth. Start small with one thing and start developing that, and then make that work for you. What we have found with our clients is that success leads to more success. So a few years ago, CareHubs introduced one online community with Mayo Clinic. Today, Mayo Clinic has 6 online communities. They have a traumatic brain injury clinical trial that they're doing through an online community. They have a healthcare transformation community that's for physicians communicating with each other on ideas to improve delivery systems. They have a professional community for social media healthcare professionals and others. And so they saw, wow, this works. Now, and people in the organization started coming and saying, we would like that opportunity. We'd like that ability to connect with our patients in those ways. And so start small, think of a place where it fits, make it work, and then see how it leads to other successes in your organization. So here's some also kind of clues as you develop these communities. Make sure that the community solves a problem. We talked about marketing. Do your research to find out if there are other competitive communities in your area that patients are already going to that would distract them from belonging to yours. That's important. That's part of the competition. Interview potential members of your community to see how well they would respond to the community if you were to set it up, and what they would want in it. Don't create this in a vacuum where you sit in a room and decide, oh yeah, I think our patients would love this. Get out and interview them, find out what their real interests are, and then also interview your key stakeholders, the people within your organization who you know need to buy in to make this work. Make sure that they're part of this process, where you make sure that they're on board and it's clear to them the value and benefit of this kind of a community. Then you're going to identify and confirm your resources. You're going to know how much time and energy and money it's going to take for you to create all of this. And keep in mind that a community manager is essential. This is not an if we build it, they will come type situation. You create a community and you have to have somebody actively managing that community initially, at least, putting in some significant time to make sure that the community grows and starts out right and is a vibrant place for people to come together for their healthcare needs. Okay, so I promised you in some of the promo information that we would provide 3 ways at least that online communities can improve patient engagement. I think we've shown that pretty significantly, but just to make sure that that's clear, excuse me, we can provide excellent patient-to-patient support through communities. You have all kinds of opportunities to do surveys with these folks. You can test new programs and ideas, and there are many, many more ways you can engage patients through an online community. Asking people to do things is a powerful thing, both about their health, but then also contributing to the community. There are specific ways to help the community grow by inviting some core people to take important roles of welcoming new people to the community and many other things. So in a nutshell, what are the rewards? The rewards are that engaged patients will enjoy better health at less cost. You will create a unique, engaged patient community that supports specific marketing objectives, and you will create a valuable asset that prepares you for the future. As we move forward from fee-for-service to population health, you'll know how these communities work, what makes them work, how they can apply to other opportunities as you move forward. So what can you do? You can start developing the ideas of where this can work within your system and how it could help accomplish your key marketing objectives. What do we do? So here's a question about what exactly does Hive Strategies, Care Hubs, and Jennings, what can we provide for you? So we have, some of you are saying also at the same time, wow, this is a ton amount of work. How in the heck do I have time to tackle a project like this with everything else I have every day already? So the good news is, if you want it, we have a turnkey solution that can accomplish this with you to really not add a huge burden to your existing organization. So, and we do that in 4 steps. There's the discover step, which is how the Hive Strategies helps you develop a roadmap to your success. Who is the community? How should it be organized? What content does it need? Who are the key players? What research needs to be done? The interviews, all of the things we talked about that are essential, that's part of the discover process. We can provide that for you. Care Hubs provides an incredible program for HIPAA-compliant online community platforms. So Care Hubs are the folks who can create and install this. We can design it, or we can work with your marketing team for the design to give it the look and feel that fits all your branding. That's the install step. We also, Hive Strategies, can help with the launch. There's some specific things to do from the beginning to help make this a vibrant, successful community. And then Jennings, Dan Dunlop and his crew are our go-to folks for managing the ongoing community, to make sure that you are effectively engaging your community to have the steady growth and results that you want. So those are the services that we provide as an organization, and you pick and choose. You say, well, we feel confident we can do A, B, but we need help with C and D. All of this is available for you and customized to be able to support your health system's needs, your hospital health system's needs. So that's my very enthusiastic, presentation about the benefit of these communities for you and how you can be a game changer in your organization and helping people see the value and wisdom of implementing these great communities. So So Dan, is it time now to open for questions?
Yeah, it is, Dan. And can you hear me okay?
I can, yeah.
I just wanted to add, because I think you've done a great job of demonstrating through lots of different points the value of these online patient support communities. But I think it's important as we approach this issue of ROI and we think about it, because all of us have dealt with hospital administrators or people who run healthcare organizations, and they do want to know what's in this for me. And it's a hard thing to tell them we're not there yet. We don't have ROI examples to share with you. But it is, I mean, saving costs by reducing healthcare costs. Through these online communities, by having patients who are able to stick more closely to treatment regimens, who take their medication. That's important, especially for those CEOs and CFOs who see the world of population health management coming down the train tracks toward us. In the current fee-for-service world, it's not quite as important, although it should be. But I think it's up to us as healthcare marketers, when we start these online communities, and we're doing this right now, to build in those tools that will allow us to track ROI. So, for example, if you're building a bariatrics community, you need to think of the online community as the new version of service line marketing. And not only do you need to have a forum there where these patients can come and talk to each other and support each other, but you need to involve your clinicians directly. You need to have good clinical information, good health and medical information there from your organization. So you are creating the connection between this service that you're providing, which is an online forum, and your organization. So the patients who are there, or prospective patients, are seeing your content. They're watching videos of your physicians talking about the bariatric program, for example, not just about surgery, but about the nutrition, about the holistic nature of it. And then you actually, in my belief, you should have call to action. You should have a click here to make an appointment button, so people can make an appointment immediately. You should have a MarChex phone number, or some kind of phone number that's trackable, so you can look at the number of calls who are coming from the online community. We've done this with a healthcare organization in Lowell, Massachusetts, where their online community for moms, where we're really trying to market pediatric specialty services, we have MarChex numbers right there on the community, where any mom who's visiting the community can dial that MarChex number. We have it tracked. We can see how many people each month or each week are calling in from that MarChex number, and we can get a sense for how much traffic we're driving actually to the call center with people trying to set appointments with these pediatric specialists. So we're not getting the dollar amount yet that we're driving, or the revenue that we're driving to the health system, but we do know we are driving people to inquire through the call center about setting up appointments with pediatric specialists. So I think we have to work to show that. That's what the C-suite people in these health systems are going to want to see. So I think it's important that we anticipate that as we build these online communities.
I love that. I mean, I'm so glad you jumped in and shared those ideas, because you're absolutely on target with that, Dan. And I didn't mean to imply from my comments that there is nothing there. Certainly, reduced cost is huge, and there are very logical ways to show the saving. And as we move forward with this, we will have great case studies that show exactly the benefits to different organizations.
And Dan, we do have some questions, and one of the first ones is Jennifer Burdett is asking about care hubs. You mentioned care hubs several times during the presentation, but exactly who is care hubs? What do they do? If you could just develop that more further for the audience, that would be helpful.
Yeah, care hubs is a software as a service company. They've created a really great platform for online communities. It's HIPAA compliant, tailored specifically for what hospitals and health systems need. They do an awesome job. They're our partners in this whole effort, and yeah, they're great. And as far as I have not found any other software solution online community in the country that markets themselves as being specifically targeted to healthcare. That is their niche, and that's where their expertise is. And so we're thrilled to partner with them on these communities.
And their experience together with our experience, Dan, they've done a number of really prestigious or online communities for very prestigious healthcare organizations like Mayo Clinic and so on. I read a list of them when I was doing your introduction, and it includes Memorial Sloan Kettering, Seattle Children's Hospital, the University of New Mexico Medical Center, the Arnold Palmer Hospital for Children, and so on. So they really do have a great breadth of experience in the field and understand HIPAA, and they have as much as you can be a HIPAA compliant online community, that they provide that.
Right, and the examples I showed from Dana-Farber and UC San Francisco and Mayo Clinic is all their work as well.
Cool. Let me see what other questions there are, Dan. Okay. Whoops. Hang on. Neil asked to go back, if you could go back in your slideshow to the slide about showing reduction in costs for if you have an engaged audience.
Okay, yeah, let's go back to, I think this is what you're looking for, Neil. And we might mention to Neil and everybody that this is going to go online, and so you'll have access to all of this. But okay, here we go. This study that was in Allied Health just this last week, researchers found that patients who were more knowledgeable, skilled, and confident, which is a result of patient engagement, about managing their day-to-day health, had healthcare costs that were 8% lower in the base year and 21% lower in the next year. This is an awesome report that another leg of it was released just recently. 33,000 patients in a health system in Minnesota were in this trial or in this survey study, and so it's a fascinating thing. But anyway, I can send Neil, if you'll email me if you'll email me at dan@hivestrategies.com, I'll send you the link to that report.
Terrific. Thanks, Dan. We've got another question, which I think is a great question. And the question is this. So once you build this online community, how do you drive patients there?
Okay. Yeah. Well, good. So
is it the old build it and they will come?
Yeah, and we know that does not work. Right. So there are two ways. If you were in a population management environment where you're treating 30,000 patients under a certain contract, then you can drive them through physicians. Physicians can say, I want you to go to this community. But until that happens, then what we have to do is we start with a core group of really interested patients. So let's say let's take a new moms group, for example. You identify 20 to 30 new moms who are interested in participating in an online community, and then you grow it. When they have a lot of interaction and conversation going on, you have specific strategic ways of inviting more people into this group and more people into this group, and then it grows kind of exponentially because the activity is so good and the information being shared is so valuable that more and more people want to connect with it. So it's a combination of marketing and word of mouth and digital advertising and et cetera to help grow it. But it's important that it grows gradually and effectively so that when people come, they see that there really is worthwhile stuff happening there, and you don't just do a big marketing push to try to get everybody to win a free iPod and by joining the community. That doesn't work.
Yeah, and I think this is such an important question because, and Dan, you probably know the data better than I do, but a huge percentage of online communities fail within the first year. It's amazing to watch this happen. It's because people build these communities with the best of intentions, but have no plan for how to manage them, how to keep people engaged, and how to market them. And our belief in the Dan Hinman and Dan Dunlop partnership is that you have to market these communities aggressively. You just can't build them and hope people will arrive. So you market them internally within your organization so that people coming in, whatever you're marketing, if it's bariatrics or if it's oncology or whatever, in that department you have signage up, you have traditional marketing reaching out to patients saying, please join us. But you also do digital marketing within that marketplace to support that. I mean, something like Facebook ads, which a pay-per-click campaign using Facebook and Google, so that people in your market, it can be very geo-targeted, but people in your market who are searching for information about bariatric surgery or about breast cancer, whatever that topic is that you're focused on in your online community, you market that through a pay-per-click campaign so that your community pops up and people know that that's an option. So we approach it just like any other marketing initiative. You have to get the word out and you have to be as aggressive as possible getting that message out. And eventually it does take on more of a life of its own once it gets some momentum and it becomes very searchable through Google. You've got all kinds of traffic and you're having daily conversation on that community through the forum. But initially, you have to go in knowing this is going to require not only a community manager, which I thought was a great point from Dan during his talk. You have to have somebody who's there to engage the people, to thank them for coming, to engage them in conversation. But you also have to have the marketing effort to keep bringing more people into the community so it just doesn't languish.
Yeah, and the stats on that, Dan, are 70% of online communities fail, according to Gartner research. But the flip side of that is almost no communities fail that are done right. Right? Those guys that are failing are the ones that didn't do their research, didn't start right, didn't have the buy-in, didn't have the didn't have the concept straight, didn't align it with their objectives and goals. Those guys fail. But when you do it right, when you go through that process and do it right, there are very high levels of success. And so I think that's really important to emphasize too, is doing it right can be highly successful.
Terrific. Well, Dan, that covers all of our questions, and I think this was a terrific session. Your presentation was full of a lot of really just solid, meaty information that I hope that the attendees today can take away with them and put it into action in their own healthcare organization and start thinking about, what should we be doing on our end to start building online communities? What do we need to do based on what we've learned from Dan? I encourage everybody who attended today to please stay in touch with us. Dan's given out his email. Mine is ddunlop@jenningsco.com, ddunlop@jenningsco.com. I'm easy to find online. I have a blog, and just Google me. But thank you so much for attending. Dan and I will do follow-up with you after this session. We have a recording of this, which we will make available online for any of you who would like to share it with your team, share it with people who didn't get to come to the session today. We also will make our slides available, so there's plenty of opportunity to access this information moving forward. And again, keep an eye out for information about our next webinar that we'll be doing in the near future. So thank you very much for attending. And Dan, thank you for all the great information.
My pleasure. I loved it. And thank you, Dan, for being the perfect host today.
Well, thank you. It was a terrific session. Everybody have a great day. Enjoy the rest of the day. Take care.